But we begin again with the COVID variant, Omicron. As it spreads across the United States, frontline workers are frankly exhausted. Hospitals filling up. 18 states currently have an ICU capacity of 15% or less in the ICUs, including Michigan, which has been struggling through its latest COVID surge for nearly 3 months. Take a look.
I have been in this emergency department for over 20 years. I have seen and witnessed things in the last 2 years that have forever changed me. I am very concerned. We are burnt out, we are tired, and we are disheartened. So much of what we see on a daily basis is preventable. However, we are still living this every day. I love my job. I love taking care of children. I have one of the most dedicated teams I've ever had in my entire career. However, we are tired. I hope that as you walk into these holidays, you take the mitigation factors that you need, like wearing a mask, washing your hands, and social distancing, so that we can hopefully slow this or stop the spread.
We're definitely seeing an increase in the amount of ventilators being used based on the patients that need that level of support because of COVID. And one of the scary, or I should probably say sad things are that these patients that are requiring the ventilator, the overwhelming majority of them are not vaccinated patients.
Because in the recent circumstances of another surge, they can become overwhelming quickly if you just kind of dive right in. Sometimes I even say a prayer prior to going into my shift as well, just to kind of get my mind in the right space.
Voices from the front lines you just heard. That's from Michigan and their ongoing battle with COVID-19 as the nation's hospitals brace for possible COVID-19 winter surge, with already exhausted healthcare workers taking the brunt of it. The president and CEO of University Hospital in Newark, New Jersey, Dr. Sharif El-Nahal, joins us now with his take. Dr. El-Nahal, thanks for being with us.
Thanks so much for having me.
Well, so first things first, tell us what's the situation like right now at your hospital there?
Well, it's pretty concerning. We've had a doubling of hospitalized patients with COVID-19 just over the last 2 weeks or so. There's a very high demand for testing that's starting to overwhelm our testing clinic. We're doing as much as we can to keep up with the demand. The waits are getting longer. Unfortunately, we're seeing cases rise in the New York metro area, especially exponentially. And if a small percentage of those cases end up being hospitalizations, ER visits, ICU stays, then we'll be in a really tough spot just in about a week or two, according to what we're projecting. So we're really readying up our surge plan again. We have everything in place in terms of a staffing plan, but more and more of our staff as well are out due to COVID-19 infection, because as these infections overwhelm the community, they also affect the very staff that are supposed to be treating patients with COVID-19. And I think that's an important fact that a lot of people often forget, and certainly one that's affecting our operation here.
And that is a really concerning picture that you draw there. So as you look ahead, as we don't know exactly how severe this new variant might be and therefore the kind of hospital burden that you guys are going to face. But what would you say are your most important needs going into this apparent winter surge we're going to have?
Well, the good news is that the president's plan announced today meets those very needs pretty well. The first and most important need is staffing. We had about 12 people out 2 weeks ago. That doubled the following week and doubled again for this week. And so while that still remains a controllable percentage of our workforce, if that trend continues, we will need the very federal assistance that the DoD folks in uniform will provide us. We were lucky enough to get the Army Reserves here in the spring of 2020 when the New York metro area was completely overwhelmed. And we may need that again in a matter of weeks. And that's a very important part of the plan. The testing plan as well is extremely important. The fact is, like I said, the demand for testing in our hospital is overwhelming. If folks can get mail-in antigen tests right to their house, to their door, to their home, that would alleviate a lot of the demand on our healthcare system as well.
And Doctor, let me ask you the question that can't be answered definitively, but that question of how concerned you are about this variant increasing hospitalizations. There's conflicting data. Some data out of South Africa suggests this variant may be less severe. The UK suggesting otherwise. Have you got a sense of that, or is that even too early to say?
so far we're not seeing an increased signal on hospitalizations that's proportional to the explosion in cases we're seeing in this area, and that's encouraging. We are seeing some encouraging data out of Europe and South Africa as well, which I think for the first time in a couple of weeks is starting to see declining hospitalizations. But what we don't know is what Omicron will do to unvaccinated people and people who got their primary vaccination more than 6 months ago. I think that group are the group that are most vulnerable to this and may end up filling our hospital should Omicron spread at the rate that it is now into the coming days. And so I don't think we can hang our hat on what we're seeing so far. I think we need to see another week or two's worth of data before we can really declare Omicron to be that much less severe. And again, the impact on unboosted people and especially unvaccinated people cannot be taken for granted. I think those folks are at huge risk this winter, as the president just mentioned.
And that's the potential tragedy, a plague on the unvaccinated, which would just be devastating. But on a national level, do you think the Biden administration is doing enough right now?
I think today's plan is really important. The fact that staffing is being offered to our hospital is just a make or break thing. I think that could be a game changer for us in being able to maintain our operation. I also think vaccine distribution over the last year has been tremendous. We've been able to get the supply we needed to vaccinate our community. We're one of the biggest vaccinators here in the city of Newark and the surrounding region. And that was not easy. The logistics around that were very difficult, weren't perfect to start with, but then quickly caught up and allowed us to have a really immunized population because of it. And so I do very much appreciate those efforts by the administration.
And just one more question. The Ohio State Representative Casey Weinstein shared a tweet today. He denounced attacks against hospital workers in Ohio by patients' family members who disagree with their treatment the loved ones are receiving. You know, the president did talk about dangerous misinformation, and he condemned it, trying the tactic, I guess, of presidential shaming on some of the people who are peddling this dangerous misinformation. But that struck us because it is so unusual to think of hospital workers and doctors getting berated or worse because of the treatment they know is good, because these people have heard about other kinds of treatments. Has that been an issue in your hospital? What do you think of that?
I think it's an issue everywhere, unfortunately, and frankly, it's shameful. The frontline heroes here have been sacrificing themselves, their own health, their own well-being, and on the front lines every single day, regardless of the fact that they've having to deal with this stress now for almost 2 years. We've had to do peer-to-peer support, psychosocial support, post-traumatic stress support for the folks who are experiencing that. And to add insult to injury by blaming doctors, nurses, frontline heroes for something they didn't do and spreading lies and misinformation about them is just completely inexcusable. The fact that this is being politicized is really, really shameful and is insult to injury for the incredible heroes that work in our hospital and hospitals everywhere.
And makes the whole pandemic worse, makes our ability to handle it, manage it, and defeat it even more difficult. President and CEO of University Hospital in Newark, New Jersey, Dr. Sharif El-Nahal, thanks very much for being with us.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.